See, I chose fertility mainly because I want to escape from ops. I thought fertility is more, 9 to 5 job, and I can take care of my kids and I can take care of my personal life, everything. But then unfortunately, that is not even true, not even a single percent true. See, other subspecialties like urogynecology or laparoscopy or cosmetic gynecology, you need not be certified to practice. Okay. You can just have interest in that field and you can work with your seniors or you can work in a hospital where they routinely do these procedures and you can be a urogynecologist or laparoscopist and like that. Okay. But the recent rules in fertility, they have said that you have to do a fellowship. You have to practice fertility. You have to do fellowship because there are a lot of controversies going around this. Okay, so you have to do a fellowship. If you want to do a fellowship, to be frank, there have been there is MCH reproductive medicine and fellowship courses and all. See, the patient doesn't come with a disease. See, fertility patient doesn't have a disease as such. Most of the patient, unexplained fertility is a major causes of fertility. It accounts nearly 30% to 40%. They are not deceased.
What is it? What difference it makes in the pay scale in the current scenario?
It is a super specialty, so obviously there is going to be an increase in your pay scale.
What is the scope for private practice, ma'am? Like not without joining any institution, like can you do a freelancing? Like you take your patient, you have your own patient and do it the procedure in some other lab, and then you follow up the patient in that way. What's the scope? Regarding like what's your comment on the scope of infertility practices in the secondary cities and towns, ma'am? Like what is the scenario now? Do you have any idea? Hello, ma'am.
Hello.
Good morning. Thank you
Good
for
morning.
joining.
Sure.
So to start with, can you share your career path from the start, ma'am? Like till what you're doing now?
Yeah, I did my undergraduation in Madras Medical College, and then I went on to do my diploma in OG DGO from Madras Medical College. Then I did my DNB from CSA Kalyani. Then I did my fellowship in reproductive medicine in ICOG PM Hospital. This is what the thing I have done till now. Yeah.
Okay, that's nice to hear. Regarding you selected, you were chosen obstetric and gynecology for your as a career path. So, did you choose to become a physician, or like did you have any dilemma which career path to select, and how did you
No
manage?
time at all. I always want to become a magician. Right the day I entered my medical school. Okay. Mainly because my parents are doctors and my mom is an magician. And she set a very, very bad example and how an OG will be there. That is, I never knew what an actual OG life. My mom
Okay.
is like living a very simple life, very, what to say, without any lots of commotion, what they talk about OG. So, when I grew up as a school girl, I thought OG will be like that. My mom, go for an OP in the morning and evening, and any emergency, she handles it in the early morning, probably, which when we were all sleeping. So it's like I thought OG is like very lucrative. My mom has a followers, real followers, not Facebook followers and all, real followers, and they really they worship my mom like anything. And so I thought it's very, very perfect. It's like there's no whatever complication which we see right now in OG. My mom never showed it to me, or she wanted to live a simple life. But for example, if she doesn't know fertility, she never went and learned fertility. Okay, she referred to a person who knows fertility. If she doesn't know a laparoscopy, she referred to a person who knows laparoscopy. Okay, whatever she knows, she practiced. She wanted to live a simple life. She wanted to do OPs and she wanted to handle less emergency. So I thought she never wanted me to become a magician. I mean, she never stressed me. like you go for this field like that. Okay, but I chose, and as I entered a medical field, I never thought OG will be this much difficult. To be frank, even after I entered only the day I entered post graduation, I actually knew how much difficulty is there. Even to be frank, in Madras Medical College, most of the work, because we have postgraduates, right? So we don't have much, exposure of OG. I mean, the real scenario won't be shown to the house surgeon. Will be giving
because
views and
we
just
are yeah,
yes, yes. In MMC, it's like that. Probably in
yeah.
colleges where there is no post graduation, probably those MBBS, the interns will be facing much more complication than us. So we were all kept in a very, very, what to say, very
Safe.
safe environment. Exactly. So when I
Can you
entered,
elaborate?
yeah, I wanted to, and more than that, the subject was very, very easy. See, I don't want to complicate my life at all. I don't want to read Harrison or, I don't want to complicate. That book was very simple, Datta and Mudalayar, very simple books. If you read just two books, I thought my career is over, my career is finished. Okay, like that. So I loved it. And that's all. So I want to become a magician. I entered, that's all.
Okay, like did you say like the difficulty like which you not thought about it? Like, can you elaborate on that, ma'am? Like, what difficulty you are actually saying
Okay.
in terms of practice in field? I'm asking like in field, what are the difficulties you are facing now currently?
As a postgraduate or as a practitioner now?
Yeah, as a postgraduate, you can say a bit because that will be
Okay.
there
Yeah,
for
let
all.
me start from postgraduate. Postgraduation was, it was a hell of my life. I don't want to go back and do again at all. Not because, see, I had a very good seniors and I got, very good assistant professors, a very good chief. I didn't have that kind of bossiness happening around me. Like usual, they see, OG and all, they'll do bossiness and all. No, nothing was that. Everybody was very casual and all. But then the working hours, the labor wards, the stress we take is too much, for me that time. And to be frank, if you go out, see, in labor ward, actually, Madras Medical College in IOG or KGH, we do at least 30 to 40 deliveries per day itself. But, and there will be around 10 people going around, and you will not be the only person. But that same stress won't be there when you come outside. You will conduct maximum 30 deliveries in 1 year as a practitioner, right? And in month maximum 2 or 3 deliveries. Though that same stress won't be there, right? When you come and practice as a practitioner. But then, to be frank, that 2 or 3 patients which you handle, you will be the single person to handle, right? You are responsible for everything for the single person. And now I practice fertility. I'm a fertility specialist. See, I chose fertility mainly because I want to escape from ops. I thought fertility is more, 9 to 5 job, and I can take care of my kids and I can take care of my personal life, everything. But then, unfortunately, that is not even true. Not even a single percent true. Of course, I enjoy the 9 to 5 job and all. If I want to work in the evening hours, I can work, but it is not compulsory. But then, only after I entered fertility, I thought it is even more stressful than ops because,
Right.
see, in fertility, people spend so much. There is no insurance. People spend so much, and they have lots and lots of personal problems. They have lots and lots of problems in their economic side as well as in their body. Okay, and they come to you with lots of hope. Okay, and they see when you do an IVF cycle, at least it will cost around 2 lakhs, which are without insurance. And
Yeah.
the success rate is very, very, very less. Is very less. Actually, Patina, the success rate of IVF overall world is only about 40 percentage. To be frank, it's only 40 to 50 percentage, which means that if I'm going to do 10 cycle IVF, I'm going to have
Mm,
success. Live birth rate is only around like 50 percentage. I'm going to give only 4 live babies, right? So the
mm,
rest of the 6 patients, I have to counsel them, I have to convince them, and so much stress is involved in that, right? So to be frank, I went into fertility just because, okay,
mm.
I thought obstetrics is stressful. No,
Okay.
fertility is equally stressful. The only thing is that probably you might have a little bit of more sleep than an obstetrician. Okay, probably because you may not have that much night calls. But then the stress you encounter and the amount of counseling you do and the amount of, see, if the obstetrics practice is just you can have a single clinic, that's all, and you have to spend on a clinic. For fertility, if you want to become a fertility specialist and if you want to become an individual practitioner and you want to start your own fertility, the investment is huge. It's very, very huge, and that stress also adds up. Okay, so I would say that okay, my path is going good, but I won't say, I won't recommend my youngsters that if you want to have a stress-free life, go into fertility. It's all how you look at that field
Yeah,
and how you
it's very
manage
vital
that.
information.
Yeah, yeah.
Same thing. Okay, where did you do your fellowship in fertility, ma'am? Like,
Yeah, I did my fellowship in BM Hospital with Dr. Vasundhara Tyagarajan. She is a great fertility specialist. She has been practicing fertility for the past 50 years, 40 to 50 years.
okay, like any other place you can say it is better in, in overall, what are the places you can do fellowships in fertility,
Yeah,
ma'am?
just I wanted to enlighten because see other subspecialties like urogynecology or laparoscopy or cosmetic gynecology, you need not be certified to practice. Okay, you can just have an interest in that field and you can work with your seniors or you can work in a hospital where they routinely do these procedures and you can be a neurogynecologist or laparoscopist and like that. Okay, but the recent rules in fertility, they have said that you have to do a fellowship. You have to practice fertility. You have to do fellowship because there are a lot of controversies going around us. Okay, so you have to do a fellowship. If you want to do a fellowship, to be frank, there have been there is MCH reproductive medicine and fellowship
Okay.
courses and all. To
Mm-hmm.
be frank, see MCH right now it is there only in private colleges. It is not in government colleges. And private colleges, as you know, you have to shell out your money. I don't know how much is worth it because the MCH courses has been into the academics only for the past some 2 or 3 years, maximum 5 years, I think. Okay, so whether it is worth to do a MCH degree and then come into fertility or fellowship is enough, that we never know because MCH they spend an extra 1 year. Okay, for which you need to spend a crore, right? Whereas fellowship can do it in 10 lakhs and you do it in 1 or 2 years and almost the same subject, everything is same. Probably MCH they have much experience in the terms of surgery and all, but the decision to do whether MCH or fellowship has to be decided by that individual student. If you can shell out some money and you can go into MCH, you can go. Otherwise, if you feel you can do only fellowship, fellowship is more than enough. In Chennai, fellowship courses are there in Triple M Hospital and SRMC, both are equally good. Apart from that, we have ICOG fellowship, which has been certified by Indian College of Obstetrician and Gynecologists, which I did, which is also equally good. So, depending upon the individual preference, they can opt for it. It depends upon how the individual perceives. See, for doing a good ops and fertility practice, the first and foremost thing is you should have a good family support. That is very important because most of the obstetrician fertility specialists are females, right? And there are various male doctors actually. For females, it's a very big challenge. If you want to excel in your obstetric field, definitely you need a very good family support. That is mandatory. It's like somebody has to be there to take care of your kids. Somebody has to be there to pick them up and put them in the school or take care of them when they are sick. Okay, you cannot concentrate on your personal life when you are in professional because it's too much stressful. And in obstetrics and gynecology, it is extra stressful because see the patient doesn't come with a disease. See, fertility patient doesn't have a disease as such. Most of the patient unexplained fertility is a major causes of fertility. It accounts nearly 30% to 40%. They are not diseased. So when you identify a disease, you can cure them. When there is no disease, it's only the counseling and is the treatment. And similarly, the ops, there is no disease. Okay, the patient comes with if the patient comes with pregnancy, it is not a disease. It's like you have to manage the complication which arises. That's all. Okay, so there is so much of counseling and so much of if something wrong happens, there is so much of counseling which you should do to the patient. Okay, so when you're in the work, you should be completely stress free. You should not have any personal things which is going around you. That's very, very important. Okay, so if you feel that you are a person who cannot manage, you want a very, very stress free life. You want only your personal life, and you cannot. You are a person, for you are a mother. You cannot believe somebody else to take care of you. See, there is nothing wrong in having that idea. Some mother feels like they should only take care of their kids. They should only make them study. They should only pick them. And if you that kind of mother, ops is not going to work for you at all. Trust me. Okay, you should trust somebody else, and you should have at least that circle to take care of your personal life. That's very important. Okay,
Yeah, I was
and
supposed
yeah,
to.
if you're a person, if you're not able to take that stress, you don't want stress. You want a very simple life. You don't want to wake up early in the morning. You want to have a routine. You want to have a routine at 6 o'clock. You have to exercise. You cannot do anything else other than exercise. You want to have a routine in your life. Routine won't work in ops practice at all. Your routine changes every day. Suddenly, you might have an emergency. You should be able to adjust. Your family should be able to adjust your situation. Okay, so see to that, because there is a lot of other fields where you can equally earn. You need not come into ops and spoil your personal life. So see to that your personal life and your inner self go towards ops, go towards fertility. That is very important. So if you have this mentality, if you have the circle around you, ops and fertility is going to be a very good and very simple profession for you. That's all.
Like, what is it? What difference it makes in the pay scale in the current scenario?
It is a super specialty, so obviously there is going to be an increase in your pay scale. And see, I think in most of the corporate they give 80,000, right, starting as a registrar. As you enter as a registrar, after completing your ops, they are giving 80, and they are slowly increasing. So if you're going to be as a consult, you're going to increase as a consultant. Probably it is around 1.5, I think, as a junior consultant. I'm talking about the corporate and the medical colleges. All right.
Yeah,
You
yeah.
don't have a private. If a person doesn't have a private college, I'm sorry, private practice, he or she
Mm.
is in the private college, and he or she is going to increase stepwise in their field. First as a registrar, then as a junior consultant and a consultant. So registrar, they start at 80,000. Junior
Mm.
consultant till 1.5 they go. And as a consultant, they pay in terms of case basis. This is what is
Yeah.
happening in most of the corporate and the medical colleges, right? And in fertility, again, as a fresher you come, probably fresher itself, they start with 1.5. And after that, here there is no junior consultant. Till now in private colleges, there is no, I think there is no gradation, right, for fertility, the junior consultant like that. So probably starting will be 1.5. And after that case basis, definitely it is going to get increased only.
Okay. What is the scope for private practice, ma'am? Like, not without joining any institution. Like, can you do a freelancing? Like, you take your patient, you have your own patient, and do it the procedure in some other lab, and then you follow up the patient in that way. What's the scope?
Yeah, it's a very, very good question, sir. See, first of
Mm.
all, before having this ART rules, you can do that without a fellowship. You can start your own clinic, right?
Mm-hmm.
And you can stimulate your patient. That is, you can do IVF to them and take the patient to an IVF center. And then you can do the embryo transfer or oocyte retrieval and all. It was that prior. But now,
Mm-hmm.
after ART rules, each and every doctor who is practicing fertility, who wants to practice IVF, should have done a fellowship. Okay,
Mm-hmm.
if they have not done a fellowship, that is, there must be senior doctors or the doctors who have been already practicing, right? They should submit to the government that they clearly have done at least 50 egg pickups. We call the egg, the picking up of the
Mm-hmm.
oocyte retrieval, we say.
Yeah.
Egg pickups, there should be at least 50 egg pickups, and they should have a document clearly mention that. Or they should have worked at least for 3 years in one of the fertility centers. Otherwise, for newcomers, you cannot practice fertility without having a fellowship. All right.
Mm-hmm.
And
Okay.
okay, if you have done a fellowship, your second question was, how will be the private practice? See, the
Yeah.
same like that of the other fields. You have to sit in a place. Your
Yeah.
business is not going to improve immediately. It might take 1 year or 2 year, 3 or 5 year. You have to sit in a place. If you are lucky, it might improve in 1 year. But unfortunately, the investment for an IVF is
Mm.
exorbitant. Okay, you might
Mm-hmm.
have to spend at least 2 crores. Okay,
Mm-hmm.
for setting up the lab, the building,
Mm-hmm.
and all the other expenses and all. So the investment part is very high. Like the other things, ops or even cosmetic gynecology, I say, the other field, the investment is not that much. You just need to sit and you have to be sincere to your time. That's all, to gather the
Mm-hmm.
patient. But here, that timeline is very less for us because it's very difficult to, somebody will be having loans and we have to repay that. So we should always think about that and then we have to start. Okay.
Yeah, that's good information, ma'am. Regarding, like, what's your comment on the scope of infertility practices in the secondary cities and towns, ma'am? Like, what is the scenario now? Do you have any idea?
Infertility is going to improve. Infertility is increasing trend in India. Actually, they have said that out of 5 couples, one is infertile. And probably in the next 5 years, out of 5 couple, two will be infertile. So almost like 50% of the couples should seek infertility treatment only. That's what the statistics says. So almost
Okay.
the small towns, even the suburbs and all, they will definitely, you have much higher scope than the city, because in city you have infertility centers every
Yeah.
street. Okay.
Yeah.
Whereas in towns and the suburbs and all, you don't have fertility centers. So if you are a doctor practicing there, you can just do a analysis of the area and you can start right away. There is nothing wrong. In the city only, you have to think about it in the city.
Uh-huh. Okay. Okay. Ma'am, finally, do you have any take-home messages for the students who would like to pursue our same career path as you? Like,
Yeah. See, first of all, nothing in your hands. Never think about your future. Okay. You don't have a timeline that you have to do a particular thing this year, another year you have to do another. Don't have a timeline at all. So at present, you will be having something in your hand, right? For example, you might be doing an house surgeon, right? You might be doing an internship. That you concentrate, please. Many of the
mm,
students, they concentrate on going into they keep on studying. That's what I always
mm,
find, students, MBBS doctors, and they keep on studying. Don't do that. If you are given 8 hours in your shift, please concentrate. That's more important. As I said, my mom did that. My mom, like, she never, like, she if she doesn't know lab, she didn't go somewhere and learn lab, and then whatever she had, she called a lab surgeon. She learned lab like that. But now what we youngsters are doing is, if you don't lab, we are going and doing a fellowship for that. If you don't fertility, we are doing a fellowship for that. If you don't know urology, we are doing a fellowship for. Ultimately, we are just keeping our hands in so many things. We are not better in best in something,
mm,
right? That's what is happening. Okay. So you are given a set of patients as an intern or as a junior consultant or as a senior consultant. Do your job. Do
mm,
your job always. You will always achieve your timeline, and don't compare anything with your friends. You don't know how much struggle they had in their life. They had in their personal life. Your friend must be doing a better lab. Your friend may be a better obstetrician and all. Okay, but they have their own timeline. You might be better than them after 5 years. Okay. Never sacrifice your personal life. Never ever sacrifice your personal life for that. Your personal life will never wait. Your kids will grow up. When you just
mm,
close your eyes and open, your kids are going to
mm,
grow up, and you're going to miss each and every part of them. I got better opportunity. As a diploma DGO, I got, in fact, on the just Chennai, outside Chennai, I got all masters. I didn't go outside Chennai just because I was pregnant at that time. I chose choosing a diploma than master just because I want to be with my kid. I want to enjoy my pregnancy. So much thing. So concentrate on personal life and let your professional life, it takes a path along with you. Okay, don't
mm,
run beyond your personal life, and you will find your right timeline. You will find the right path. Okay, some point, probably in 5 years or 10 years or 2 years or whatever. Yeah.
Thank you so much, ma'am. I think the academic information as well as the personal advice which you have given will be very useful for the students who would like to pursue the same career path. So thank you so much, ma'am. Thank you so much for sharing with us. So it will be very helpful for the students. Uh,
Sure, sure, sure.